recent months, the H5N1 bird flu has made headlines across the country, and it's reached California. What is H5N1? How did it spread? And how can it pose a threat to humans? In this video podcast, we'll explore those questions with an expert. I'm here with Celeste Prothro from Kaiser Permanente, who specializes in infections, prevention, and hospital safety. Join us as we break down what you need to know about H5N1 and the science behind its spread. Hi, I'm here with Celeste Prothro, who works as a director in infectious disease at Kaiser Permanente. Thank you so much for joining us today, Celeste.
Thanks for talking to me.
There's a huge growing concern about H5N1, also known as the bird flu. To start off, could you explain what exactly H5N1 is and why is it making headlines right now?
For sure. So the strain H5N1 is just a different strain of influenza, and it's one that's typically found in birds, although there's plenty of different types of flu that are commonly found in humans. We often talk about flu A and flu B. Those are really common types of flu found in humans. But you also might remember your parents talking about a flu season that was about 15 years ago, which was also, it was H5N1 flu. So basically we have had strains of H flu that have been circulating in humans before. So this is just another variation that's most common in birds, but can also cross over into cattle, and then occasionally is jumping to humans.
Okay, awesome. Bird flu is infecting humans. That sounds pretty scary. How common is that? Can H5N1 really jump from birds to people?
So we've had, I think to date in the US since September, 70 cases of humans known to be infected with avian flu, this H5N1. So that means that actually we have 70 people who were tested. We don't know if there's others who maybe were untested. And in the state of California, I think I saw that it was 38 confirmed cases since September. In all of the US 70 cases, there's been one death. So it is not frequently jumping to humans, but it is occasionally. And I think one of the most important things to know is so far, we haven't seen any human-to-human transmission. So in order for this to really blow up and become the next big thing, it's got to be transmitting from humans to human. And we don't see that happening yet.
Yeah, I agree. Yeah. So even though your role focuses on infectious disease prevention in hospitals, do you have any insight into how farm and wildlife workers are being protected from exposure to bird flu?
Yeah, so I did a little bit of research on what the Centers for Disease Control has to say about like workplace safety for somebody who might work with birds, cows, et cetera. And I see that they have a lot of recommendations. And I can walk through some of those, but the other question is like, how good are employers at following those recommendations? And how good are people at doing the steps one by one and correctly? So a couple of the big ways that flu can infect you is by either getting in your mouth or getting into what we call your mucous membranes. So that can be like eyes, nose. So when you think about working with birds or with cows, you know, there are some ways that come to mind that might get stuff in your eyes, such as if you're milking a cow and that milk could splash. So just like in the hospital, I can see that they recommend things like wearing goggles on your eyes and wearing a mask, wearing gloves. And as I said, there's some challenges sometimes with getting people to be able to do their job with all this extra stuff on effectively. So we found in the hospital during COVID that like everyone was supposed to wear eye protection, but those goggles would sometimes get fogged up and they couldn't see what they were doing. We had to test out like different types of goggles to both provide protection, but not get in the way of being able to do your job. So I can imagine for somebody who works on a dairy or poultry farm that finding like the right kind of protection that can still work so they can get their job done is important. And also teaching people to do the steps right in terms of like taking it off the right way so that you don't like get your hands contaminated as you do it, that sort of thing. So I can see that the common recommended PPE, as we call it, which is personal protective equipment, for like farm workers includes if you're going to be high risk for exposure, like if you're going to be dealing with milk or also like dealing with the dead bodies of potentially infected um, birds or cows, right? Because somebody's got to clean that stuff up. They're recommending hair cover, goggles, uh, N95 mask, like a apron or coverall over your clothes, disposable gloves, and boot or shoe covers.
Yeah, that's
So yeah, there's a lot to put on. And, think about summertime in the Central Valley of California and how uncomfortable that could be. So oftentimes what we found in the hospital that is like, it's one thing to say, these are all the things you're supposed to wear, but it's another thing to be like, how can we actually make this work for people so that they'll use it?
awesome. So would you say, or if someone would be able to get infected by H5N1, what vaccines or treatments would are currently available?
So our current seasonal flu vaccine is not effective against H5N1 because what they do is they create a mix of the common circulating strains of flu. Usually when you get your flu vaccine, they call it trivalent, which means three. They choose the top three strains that are circulating usually in South America during our off season, which is their winter, their on season. And H5N1 is not currently one of those three in the trivalent. So it doesn't protect against H5N1 vaccine. If we did start to see it, H5N1 in humans, probably we'd see a vaccine being created really quickly, like we did with COVID. I did some research to see if the seasonal flu vaccine has any like bonus protection for H5N1, and it doesn't. Still, you should get your flu vaccine to protect against all the other kinds, but it's not going to help with avian flu. In terms of treatment, our common antiviral that we use for all the other types of flu, which is called Tamiflu, is effective for H5N1. And the one thing I did find is that they're recommending for hospitalized patients to use it for a few more days, like a little bit longer. But same drug, same concentration, just maybe an extra few days is the recommended treatment. And that could be, it can be prescribed outpatient too. So it doesn't have to just be for somebody in the hospital.
Well, I think that's it. Thank you so much for your time and helping us understand the risks and precautions of H5N1. We really appreciate it.
Totally. At any time you want to talk infectious disease, Julian, I'm happy to chat.
Awesome.
Okay. See ya.
Thank you so much.